I guess my first question is, what do you think Australia's role is, or perhaps should be, in contributing to global vaccine equity, or at least, play its part to address the uncoordinated patchwork of immunity?
So clearly Australia is near the top of that greedy list. And I've seen a league table that says it's even further up that list. It's actually at the top of the list with more than 4 times the amount it needs. But it doesn't really matter whether it's at 2.5 or 4 times. What it needs to do is assure the world that when it has approaching 100% of its population covered, it will make sure that the other orders that it has in place are reallocated to other countries. That seems like the minimum that anyone would expect a country like Australia to do. I think Australia could also be more generous in relation to Gavi and COVAX than it has been. I don't have the numbers at my fingertips, but I believe that it's been fairly miserly in terms of its contributions so far. And it has come late to the table in relation to waiving TRIPS obligations, but it has now supported that proposal, has now got behind it. And as a result, it's in a position now to try and persuade the remaining countries that are not, and to encourage them to get over the line so that happens. Because if you could start to harness the manufacturing power of South Africa and India for those vaccines, clearly you could have a sea change really in the volumes of vaccines that could be being produced. Particularly, India has massive capacity to be producing vaccine.
Yeah. Finally, at a community level, Barbara, do you have anything to say to those who have fears around taking the vaccine?
So I think there are a large number of different explanations of people's fears, and therefore one message is probably not appropriate. So people in Australia and in different communities may feel that some of the advice they've been given has not been reliable about other matters, and therefore they're skeptical about this. Others are reading very bizarre stuff on Facebook and similar about being injected with tracker devices and being made infertile by the vaccines and so on. So I think that those whose problem it is to try and persuade hesitant populations to take the vaccine have to really understand where that hesitancy is coming from and respond on a, if not case by case, perhaps community by community basis, to make sure that the kinds of things they're saying are likely to be more effective. But at the moment, I don't think there is evidence that the extent of vaccine hesitancy is all that great in Australia. I've heard it estimated at about 10% of the population, which, if that was distributed evenly across the whole population, would probably not be a very big problem. Of course, the issue is that it will be in pockets. So, I think communities need to understand that it's not just in their own interests, but in their whole community's interests, to listen to the public health advice. And I think it is important to say to people, this isn't just about you thinking about whether maybe you think you're healthy enough that if you get COVID, you'll be fine. It's thinking about the benefits for your whole community and whether you'll pass it on to people who are more immunocompromised or just frailer, for who that's not the case. They're not just making a decision for themselves, they're making a decision for their community, starting with their family and moving out, all the people they know.
Thank you, Barbara.